First question, can diverticulitis lead into something worse, something more fatal?
Yes. So diverticulitis is an inflammation of little diverticulum, little pockets that can form in the colon. We think, although not 100% sure, we think that it's related to a lifelong lack of fiber. So you tend not to see it in certain populations, like in Asian populations, you see less of it, and you see it more in Western populations, just because the diet is less fiber. So in order to have diverticulitis, you have to have the pockets themselves. There used to be an old wives' tale, and still is perpetuated, that if you have seeds or nuts that get caught in one of these pockets, that somehow that'll cause the inflammation. There's never been any studies that prove that. And so, and again, seeds and nuts are a good source of fiber, which is what you want to have. Now, if you do develop diverticulitis, there's what's called complicated and uncomplicated. So uncomplicated diverticulitis is where one of these pockets just gets inflamed. And usually the person will present with abdominal pain and sometimes some low-grade temperatures. They know something's not right. They're calling the doctor. It's not insignificant pain. And usually it's on the left side in the sigmoid, because that's the most common location where the pocket. So, but sometimes people can have pockets throughout the colon. So sometimes people can present with right-sided pain. But more commonly, it's usually in the left side and usually left lower. So if you draw a line through the belly button and make like an X, it's usually in the left lower quadrant. Okay? So that's uncomplicated, and that usually responds to antibiotics. A lot of times we make the diagnosis just based on clinical, like someone shows up in the office. If we're not sure or we want to get more information, we'll do a CAT scan. And that's how we make the diagnosis. Complicated diverticulitis, there are different things that can occur. So, like I said, with uncomplicated, it just means that there's inflammation. But complicated, you can have what's called an abscess formation, where you form like basically a big zit, like a big pus pocket there. And that needs, depending on the size, may need to be drained, either surgically or through like catheters to stick in there. You can get strictures where they get from all the inflammation that the colon, just, which is a tube where you pass your stool, can get narrowed. Or the worst one of the complications is a perforation, where actually it opens up or rather than forming like a pus, like sort of like think of it as like a walled off zit, like it's a big pus, that it can just open and then it spills into the abdomen, and stool and other things can go there. And that's an emergency situation requiring surgery, which can be life threatening if something is not done.